How is sensorineural hearing loss diagnosed? Have you ever wondered how healthcare professionals determine if someone has sensorineural hearing loss? This type of hearing loss involves the inner ear or auditory nerve, and diagnosing it requires a thorough process. First, a healthcare provider will gather a detailed medical and hearing history. They will ask questions about the patient's hearing difficulties, past medical issues, exposure to loud noises, family history of hearing loss, and any symptoms like ringing in the ears or balance problems. This information helps identify potential causes and risk factors. Next, a physical examination of the ear canal and eardrum is performed. This step is crucial to rule out any outer or middle ear problems, such as earwax buildup or infections, which might cause hearing loss but are not sensorineural in nature. The primary test used to diagnose sensorineural hearing loss is called pure-tone audiometry. In this test, the patient listens to sounds at different frequencies and volumes through headphones. The results create an audiogram that displays the degree and pattern of hearing loss. Typically, sensorineural hearing loss shows a loss in higher frequencies, with similar levels of loss in both air and bone conduction thresholds. This indicates that the issue lies in the inner ear or auditory nerve. Another important test is speech audiometry, which assesses how well a patient can hear and understand speech. This helps confirm the impact of hearing loss on communication and distinguishes sensorineural loss from other types. Tympanometry is also performed to evaluate middle ear function. This test measures how the eardrum moves in response to changes in air pressure. Normal results here suggest that the hearing loss is likely sensorineural rather than conductive. For a more objective assessment, auditory brainstem response testing is used. This test measures the electrical activity in the auditory nerve and brainstem when sounds are presented. It is particularly helpful for infants or individuals with disabilities, as it can confirm sensorineural hearing loss and evaluate nerve function. Otoacoustic emissions testing is another method used. This test checks the function of outer hair cells in the cochlea by measuring sounds produced by the inner ear in response to stimuli. If these emissions are absent or reduced, it may indicate cochlear damage, which is common in sensorineural hearing loss. In some cases, imaging studies like MRI or CT scans may be needed to rule out structural issues affecting the cochlea or auditory nerve, such as tumors or nerve damage. The diagnosis of sensorineural hearing loss relies on a combination of these evaluations. Confirming any damage or dysfunction in the inner ear or auditory nerve pathways is essential. Early and accurate diagnosis is vital for effective management, which may involve hearing aids, cochlear implants, or other rehabilitation strategies tailored to the individual's needs. Consulting an audiologist or an ear, nose, and throat specialist is crucial for a comprehensive evaluation and personalized medical advice. Avoid self-diagnosis or relying on unverified treatments to ensure safe and effective care.